My pain got to a point where I couldn't take it anymore. I was 31, and it is not normal for a 31-year-old to not be able to walk down the street without pain. And that was at the point where I truly was like, I can't do this anymore. I truly didn't think that I was going to be pain-free or even be able to be a human being. I struggle with depression, and whereas I'm not completely pain-free all the time, I did not see an end to it before, and I don't even think about that anymore. I've been dealing with chronic pain for a lot longer than I realized I was dealing with chronic pain. It took my body, I don't want to say breaking, but it took me tearing my hip to realize that I had been dealing with a lot of chronic pain. So I would say I've been investigating my chronic pain for about a year now, but my chronic pain has probably gone back at least 12 years now.
Autumn is a lovely 31-year-old woman with left anterior hip pain, left knee pain, left anterior ankle pain, and her shin was really bothering her. And it started in December 2023, so she had about 9 months of pain. First, she tore her labrum a couple months prior to that. Her whole left leg and foot was numb, and then that kind of got better, but when she was lifting, her ankle and her shin was really bothering her.
The places that I was experiencing pain on my body originated from what I thought was my hip, and then after coming here, talking to doctors, doing the whole everything, it originated from my back and more specifically my tailbone. My pain got to a point where I couldn't take it anymore in about June, July of this year, so this is 2024. I had been dealing with the chronic pain about 9 months from then. At the time, I was 31, and it is not normal for a 31-year-old to not be able to walk down the street without pain. And that was at the point where I truly was like, I can't do this anymore. I need to figure out what's going on. It was keeping me from just living my life because I was constantly thinking about it. And I know there's a point where it's, oh, just like get past it. I could still do the things I wanted to do, but I couldn't do them actually enjoying them or being happy about it or thinking, what is this pain going to cause me or stop me from doing later on? My initial feeling walking into the door at Barefoot Rehab was truly that, what was I doing? I had found Barefoot off of a chronic pain forum on Reddit, and to me, that's telling of the rock bottom that I felt like I had hit. But just walking in, I myself am not the most introspective, touchy-feely person, and coming in and being hugged by many individuals, I was just very much like, oh my God, where am I? What is this? Why are they hugging me?
She found something about adhesion release methods providers on Reddit, and she wasn't sure if she had nerve damage because when she tore her hip labrum, her nerve symptoms were really bad in her leg. She had this pinch in her hip, her glute was spasming. She just wasn't sure what was going on.
There's a long list of practitioners that I've seen before coming to you guys. I went to see a neurologist, I went to see an orthopedic, I went to see a pain specialist management, I went to see my general practitioner, and from there I went to see multiples of those because it was very much your tests look fine, your scans look fine, there's no reason for your pain. I had a pain management specialist ask me if I was just an anxious individual and told me to calm down. Like most Americans or individuals or even women that are my age, I struggle a lot with anxiety and depression. And there's a reason that every time I go to the doctor, they ask me if I'm anxious or anything. It's in my chart. I'm sure it is. They read it and they immediately dismiss me. But with that being said, I exercise and I use exercise as a way to feel better. So when I injured myself, and I've been going through chronic pain for the last year, not being able to exercise has been the absolute worst, or even thinking that down the road that I'm not going to be able to. That was the hardest part. Coming here was hope, and then on the flip side also helped.
When I first did the consult with her, it was really fun because at first she was very closed towards me and was like, I don't know why I'm here. I don't believe that you're gonna help me.
He said my sciatic nerve sucked. I remember that. There was a lot of things.
And she was trying not to smile. She wasn't trying to, I'm trying not to smile. She wasn't trying to smile at all. She was just skeptical.
First day walking into Barefoot, my pain was on a scale of 7 to 8, depending on the day.
And what about right now?
At this very moment, my pain is anywhere from a 0 to a 3, depending on the day.
What's really cool with adhesion release methods is that it's a real-time analysis. So often, especially when we get people younger, further away from 60, 70, 80, they can get really fast, quick results. She was already 10% better after the first treatment. So she's like, oh, this isn't what I normally expect from the chiro, PT, massage therapist, whatever.
Chris is a wonderful human being. When I first met Chris, again, everyone here hugged me and it was very strange. I'm not typically a hugger, but now when I come in, I'm so excited to be hugged by everyone and see everyone. Chris is definitely unorthodox and I like that about him. He listened to me, he has no bullshit, and he'll just tell you straight up, like, no, you can't do that, no, you shouldn't do that, I would prefer you didn't do that. And that's so refreshing coming from a trained professional. When I would ask, I just want to know what I should and shouldn't be doing. I don't want to know, in an ideal world, what would happen. Just like, you know, cut the bullshit with me, tell me what's going on. The treatments that are used here, I would say, are definitely not the norm. Maybe I would call it voodoo magic, because the very first couple times I was thinking there's absolutely no way that this is going to work, until I was walking my dogs, I think maybe the third visit, and I turned to my husband and I was like, I think that crazy voodoo magic is actually working. Like, this is insane. It's uncomfortable, and at the time you kind of wonder. There have been some times where I thought that maybe James was gonna pop my hip out of its socket or my leg was gonna come out, but that never happened, and I always felt much better. Now that I've finished my barefoot case, I am continuing with the longevity. I've already signed up. I'm excited for it. I was actually super panicked thinking that I wasn't gonna come back after the 16th case. I would recommend that anyone come here. I think it's criminal and wrong that it's not endorsed and supported by health insurance or other practitioners. This has been life-changing, and I've told many people that, hey, you should either come here or you should try to find someone, because it's crazy how night and day things are different. The change of having any day be a 0 or even a 3 has been insanely life-changing. I can't stress enough how different it is to be able to just go to work and walk around and not think about my leg, or not think about the change in sensation in my leg, or can I walk my dogs without being upset about the pain. I truly didn't think that I was going to be pain-free or even be able to be a human being. And whereas I'm not completely pain-free all the time, I struggle with depression, and I did not see an end to it before, and I don't even think about that anymore.